and it's on SPAN. Some people asked what that was, and it's Single Payer Action Network. And that's why it's up there. Healthcare is a human right. So when we get to our can't hear it at all. Well, we're gonna have to try both microphones, and we have a new attempt where our speaker today is going to be on a little tiny mic that my brother was experimenting, folks. We're gonna try to make it work. So, we're gonna open with some announcements. Anybody got an announcement besides Mike Schreck? There you go.
There's two microphones now that you can...
How many of you have seen Dead Man Walking, the movie, Susan Sarandon? Well, the real Sister Helen is here in town tonight. And if you've never heard her, she is incredible. At Mount St. Joe at 7 o'clock, Sister Helen Prejean. She's an awesome speaker. 7 o'clock at Mount St. Joseph.
My name's Monica Lira. I haven't been here in a while. I'm back now. Hi, it's good. And I am the purveyor of the signs that are up in yards everywhere in Cincinnati. And I've seen them as far out as Richmond, New Richmond. If you like one, in Spanish, I do have those. They're for sale for $10. There is a website on Facebook about, no matter where you're from, I think it will direct you to me. I'm the only person in Hamilton County selling them. So, here you go. If you need them, I've got them.
Hi, Bernadine Zenny, and we did go to the We Build the Wall event last week, when was it? I don't even remember. Last Tuesday, correct. Oh, my life. Anyway, we did go, and we were able to get in. Don't ask how, but we did. And they were on C-SPAN, they were on that Cable One, whatever, and they had Fox there. But the crowd was so small that I decided not to disrupt the meeting and just listen. And it's funded by this billionaire. I go around and get real obsequious and ask questions, and they're great. They just give me answers. So it is funded. We Build the Wall is funded by a billionaire, single person. And it was so small, I thought, I'm just going to save my disrupting capital for something big, like a Senate meeting. Anyway,
Thank you.
Friends, Romans, countrymen, lend me your ears. As you can tell, my wife has been teaching Julius Caesar this semester. I come to support and not to bury the metro system. And representing the Better Bus Coalition, we now have a petition. This petition is to add a 2/10 to the earnings tax for the city of Cincinnati as a first step towards propping up the system and hopefully at some point in time getting enough money from the state and the county ultimately to improve the system. But if we don't do anything, at some point in time you will find that everyone will be walking. Whether it's you or me or somebody who just has their thumb out because there is no bus to ride. These particular petitions obviously will not do anything but put a ballot initiative on the ballot. This has nothing to do with property taxes. It has absolutely nothing to do with the streetcar. This is only the city earnings tax. If you have a Cincinnati mailing address from which you vote, then I would like to see you and have you sign the petition. Because I'm going to presume that virtually everybody here is a registered voter, but some of you may not live physically in the city of Cincinnati. If you do not, I do not want you to sign this petition. There will be other things for you to do later on as things look to go countywide. But for now, come see me towards the end of things, and we will get you to sign, and I will witness. Thanks, Mike. I could put a notice in the newsletter for future on.
Donna?
Okay, sure.
No, he's going. He's going to go first.
There's a socialist convention in Chicago in the week of July 4th for 4 days. I think it starts on July 3rd. It's $90, $55 for students. If you want to know what socialism is about, they're really hardcore though. But Naomi Klein is the big speaker, but there's zillions of speakers. A lot of breakout sessions. It's just a fabulous buy. Also, the hotel is $109 plus tax for 2 beds at the Hyatt that's right there, right by the convention, McCormick Place. So it's a real big deal, but the hotels fill up really fast. That's why I'm telling you right now. But it's a great event.
Go for it.
Okay.
Donna.
Okay, tonight there is another Shabbat Town Hall. And it's from 4 o'clock to 5 o'clock at Urban League of Greater Cincinnati. That's 3458 Reading Road. Zip code is 45229. I know there's one more after that, and I don't have the information on that. It was on the Indivisible District 1 website.
Repeat it.
There you go.
Okay, it's at the Urban League of Greater Cincinnati, 3458 Reading Road, and that's zip code 45229, and that's at 4 o'clock to 5
Today?
today. Does anybody want this?
Other announcements? Other announcements? Okay, so it brings us to our speaker who is going to come up. But first, we're going to have our speaker introduced by our Sid's mother. Wait, Sid, wait. There's Sid, our youngest Democrat there. And his mother is named Deb Shrek. And we're going to hear her introduce our speaker for today, Dee Chavez.
Hi everyone, thanks for having us here. Dee and I and about a dozen other folks went up and saw Jessica Miranda's aide, Tom, on Wednesday last week. This is for the Single Payer Action Network to try and get health care for everyone in Ohio, every single person. So that was a really good turnout. It was about 40 altogether from Stan, Ohio, that went and saw multiple representatives, about 40-some of the 99 representatives. And I am here just to introduce Dee Chavez. She is a retired RN, a registered nurse. Alberta says I need to be louder. She worked for 43 years in both adult and pediatric nursing. She has a bachelor's from the University of Kentucky from 1972. And she also is working with the Physicians for a National Health Plan. She is currently the Region 4 coordinator. There are 7 regions in Ohio, and that is divided up based on how the different health commissions are administered under the Ohio Department of Health. So there are 7 total, and they were smart and they said, hey, let's line up our regions based on how the health department does it. So Dee is here. I know she has a helper here as well, who Kendall Mays, who might also help answer some questions. I hear another person helping him out. So I would like us to give a warm GCD welcome to Dee Chavez from Stan, Ohio.
Okay.
Turn it on. The red button, turn the red button off to green.
I don't know how to turn computers off and on. Oh. I think this got changed a little bit, yeah. Oh, so then we just need to turn this back on.
It's your computer's not, you need to set,
Computer's on the right place.
Okay, okay.
there we go.
Okay, now.
Now we want to go to this one. How do we get to this one? How do we get to this one?
Dan, could you throw the book?
Yeah, hold on. Okay. Let me sneak by you here.
That's what's showing on the miracles of modern technology.
Kim, just before you leave, I'll sign your petition, but I wanted to talk to you about getting Sam Hardy to come speak to you.
I've already talked with him about it, given his number.
Oh, okay, because I sent him an email yesterday.
If they can't fix it, that's fine. So, who, is this, can you hear all right? Loud now? Oh, louder, okay. Who knows what single payer is? Just raise your hand. And who knows what Medicare for All is? And you know that it's the same thing? Okay, that's good. So, as I'm sure most of you are aware, over the last several years, 30 years probably, it's become increasingly difficult for people to access health care. And I saw this in my career, just growing and growing. And even, I worked for 30 years at University Hospital, and then 14 years at Children's, and some of that was overlapping. But even for kids, it got harder. And Children's has all kinds of resources to help kids. I mean, they would never turn any kid away. But there were parents who would say, I can't bring my child in because I can't pay the deductible, or I can't pay the co-pays. And I'm talking about outpatient now. If they had, an emergency, they usually didn't hesitate. But a lot of adults don't even access emergency care because they don't want to end up paying their deductibles. So it's a sad state of affairs, and it's gotten worse gradually. A lot of us in this room are on Medicare, so we don't have to worry too much. We have to pay premiums, but it's there for us. Now, the Medicare for All and single payer plans that are being talked about are actually expanded and improved Medicare. So Medicare right now, unless you have a supplemental plan, doesn't pay for dental care, vision and hearing, or long-term care. It does pay for a short amount of long-term care. Okay. All right, so this is our banner. So I'm going to, you probably know about Bernie Sanders' bill that, and it's recently been reintroduced by, what's her name, Paul? Yeah. Now, Span, Ohio, I'm going to give you a little bit of history and then we'll go through the slides. Well, let me go through the slides first, because this is more of national information. And this
PowerPoint was created by a physician, Matthew Norsey Jones, he's up in the Dayton area. This is supposed to show the mishmash that healthcare is right now. And a lot of it is due to administrative costs, the numbers of insurance companies that are out there, and the difficulty for people to decide which one to choose, which one is going to cover me better. I just have to laugh when I hear ads on TV that say, oh, you can choose the plan that's right for you. Yeah, sure. How do you know if you're going to have a heart attack, or you're going to have cancer, or you're going to get hit by a Mack truck? You don't know what's going to happen to you. So that's just ludicrous. But anyway, it's the complicated system that we have. It's just crazy. Okay, this is per capita spending, and this is the U.S. statistics. At the bottom, you have the U.S. The total amount of spending is $9,900. In other industrialized countries, many of them are less than half, some, a little bit higher. But we're way, way higher than than all of those countries. All of them. We're at the bottom in terms of industrialized countries. And that includes public spending as well as private spending. Life expectancy, this is a shocker, is lower in the U.S. than it is in all those other countries, the industrialized countries. And it's going down. It's actually going down a little bit. It's gone down 0.1% the last year. 78 is the overall life expectancy. Of course, it's higher for women, lower for men. That's a shocker, I think. Infant mortality, I think this is shocking and just incredible. It's just unbelievable that it's so much higher in the U.S. than in other countries. 6 per 100,000 births. And you can see where the other countries are. And then the next one is maternal mortality. That's shocking. Okay, this is just comparing the whole U.S. to the state of Texas. I'm not sure why this is in here. For some reason, Texas is really bad. Actually, Ohio's pretty bad too, and I'm going to get to that. Okay, rising economic and health inequality. Okay, and this shows kind of what I was talking about, that even Americans with average or above average incomes don't have as good of access to care as in other countries. And that's because of the cost of premiums, co-pays, and deductibles, and avoiding care. This is just a chart that shows the gap between the rich and the poor. Women and men. This is the one for rich and poor. Sorry, that one was men and women. Okay. Some more of the same stuff. Now this goes back to 1980 and shows what the life expectancy was at age 50, and then in 2010, and look how much higher it is. And then this is a quote that we like to use from Martin Luther King. How the injustice of not receiving health care is the most shocking and inhuman. Oh, sorry. All right, and then we get into racial inequalities, which we're all aware of. So I'm not going to go through all these details because it's just I'll show a few more of these because, but it's just, we all know that blacks and Latinos for the most part don't get as good a care. It's partly because of income inequality and just difficulty having access to care. So their infant mortality rate is higher, their maternal mortality rate is higher. And this one, psychiatrist visits for minority children and youth. And this is important because you know, there's a higher incidence of depression and suicide in teenagers. And it shows the death rates of the life expectancy. All right, so the takeaway is we spend a lot more, but we're not healthier, and we don't live as long. Okay, a couple more slides. This one I think is kind of hard to read, but it shows when Medicare and Medicaid intervened in 1965, I believe, that the uninsured rate went down, and then now it's gradually going up again. And, you know, here we are. I don't know where we're going to be in 2020. It did drop here because of Obamacare. That really did help a lot of people. Okay, now a couple more slides. Keeping private insurers in charge. Let me go back. I'm going to show you the one that shows what the CEOs make. Oh, there it is. No, that's, yeah. Okay, well, I'll tell you what it is. I'm going to stop using that now because I'm going to go to span. But the salaries that CEOs of insurance companies make, some of the top insurance companies, are between 10 and 20 million a year. The salary of the administrator of CMS, which is Centers for Medicare and Medicaid Services, is $176,000 a year. And he or she manages millions of people's health care, as far as the financial part of it. The salaries for CEOs of pharmaceutical companies, one of them is $98 million a year. That's for Gilead pharmaceutical company, and the rest of them are like in the 20s and 30s. I don't know why he makes so much. And then, oh, I mentioned per capita spending. I also want to mention the spending on drugs. In the U.S., per capita spending on drugs is $1,026. That's out of pocket, I think. And then in Canada, Germany, France, Australia, it's from $500 to $700 per capita. Okay, so now I'm going to tell you about SPAN. SPAN started in 2001. 8 people got together up in Cleveland and said that they were going to form this grassroots organization. It wasn't called SPAN yet, but they renamed it shortly after that. The early people in SPAN were very intelligent, and they worked with legislators and created the bills that we have, or have had in Congress. We've had bills introduced every 2 years since 2004 in both the Ohio House and Ohio Senate. The bills have never gone anywhere until last year. I'm going to tell you more about SPAN before I get into that. So we're a statewide organization. We have a state director. We have an 8-member executive committee and about a 50-member council. And we have a database across the state of thousands of people. It's really been growing. I think we have at least 5,000 or 6,000 now, maybe more than that. I'm not sure about the other areas. There are 7 regions, as Deb said. So we do meet monthly here in Region 4, here in Cincinnati. Although we cover 8 counties, and I'm trying to get organized to reach out to some of the other counties. We are actually going to go out to Claremont County later this month. And the state meetings, the council meetings are every 2 to 3 months. The other thing important about SPAN is that we, last year, were able to commission an economist, Dr. Gerald Friedman from University of Massachusetts, to do a financial impact study on our bills and how it would affect our state. And I have handouts back there of just a very short summary of how it would impact you, how it would impact physicians. And it's just a no-brainer. It would be much, we'd save so much money. So I'm going to tell you some statistics in Ohio. The Health Policy Institute of Ohio has, for two times now, in 2014 and 2017, put out a health value dashboard. I don't know why they call it dashboard, but it's a composite measure of Ohio's performance in healthcare outcomes and healthcare spending. And Ohio ranked 46th out of the 50 states and District of Columbia. It says, why do we rank so poorly? Ohio performs well on access to care, but poorly on health. Access is necessary, but it's not sufficient to improve overall health. Ohio performs poorly on other factors. And they have lots of different recommendations. Now they're going to put out another dashboard in April, which is going to be very interesting to see because they measure outcomes again and compare it to what it was this last time 2 years ago. But I'm just going to give you a few of the metrics. Infant mortality, we rank 39th in the country out of all the states. And it did worsen from 2014 to 2017. Cardiovascular disease mortality, we rank 40th. Adult smoking, we rank 43rd. And that actually did improve from 2014. And children that are exposed to secondhand smoke, we rank 49. Drug overdose deaths, this won't be surprising, we rank 49. We know we're the second highest state for that. And another couple more that are pretty unbelievable. Cancer, early stage diagnosis, all types of cancer, we rank 46th. Food insecurity, 45th. So these are just astonishing figures, I think, which it even makes me feel more dedicated to getting this bill in Ohio. Now there are 15 other states at this time that are working on single payer systems. I think there have been a few more in the past that have kind of let it go, but right now there are 15 other states. And I'm reading that Maryland is the state to watch because they don't have as many impediments on their tax laws. I'm not sure all the details. But California has come very close too. New York has come close. Oregon, New Mexico made a valiant effort. Colorado made a valiant effort. They're still working on it. And even Kentucky has an organization. So they do, for what it's worth. Arkansas, do you think they do? I don't think so. So what's been going on recently, what happened last year is we've been doing more, well, okay, let me go back. In 2004, we started a petition process to get an initiative on the ballot. And we didn't have enough people in SPAN that were active enough to get enough signatures. We got over 5 years. we got 100,000 signatures. We needed more like 150 or 180,000. And 5 years is too long anyway, because as you probably know, if you've done petitioning, you have to have people with current addresses and people that are still alive, and they have to be registered voters. So it can be a problem. So we decided after 5 years to stop that effort because we knew we couldn't get there. And at that time, Obama was coming into office, and we had high hopes for what he would do. But since, you know, I do think the ACA has helped a lot of people, primarily through the expansion of Medicaid. Medicaid is a type of single-payer organization, and it has really helped a lot of people. But what we're doing now is concentrating on the legislatures in Ohio, or legislators. And so we've been reaching out to all the legislators in our region. Now, the Democrats have all been on board with our bills, but we don't have that many Democrats in Southwest Ohio. But we reached out to Tom Brinkman, who is the chair of the Insurance Committee in the House, and Don Rucknagel, who most of you probably know, and I went to see him. And he admitted to us that healthcare is a mess, and so we presented the whole thing and asked him if he would give us a hearing in his committee. And he said, yeah, let's do it next week. Well, Dawn and I about fell off our chairs because we've never had that before. We didn't get to do it the next week because we wanted to have this financial impact study done. But we did go up to Columbus in December, and there were 40 people that testified. Individuals who had their own healthcare issues or families, business people. Dr. Friedman testified on the financial part of it. Doctors, nurses, other healthcare workers. And it was compelling. It was very compelling. And the first session that we had, the room was standing room only. And we just kept, more people were coming to testify. And so Tom Brinkman said, well, I guess we're going to have another session because we'd gone for 3 hours, almost 3 hours. So he scheduled us for another session a week later. We went up and again filled the room. And my understanding, I didn't talk to Brinkman myself, but my understanding is that he said he would move the bill forward after the first of the year. So the bill's going to be reintroduced both in the House and the Senate. We don't know when. We're working on getting co-sponsors now before the bill's introduced. And we just went up for a lobby day last week and talked to close to 40 reps or senators. And I understand we've got a lot of people on board. But the point I want to make is I think even the Republicans are seeing the writing on the wall. I have to tell that we talked to George Lang twice. He's, if anybody knows who he is, he's up in Butler County, very, very conservative. We haven't convinced him yet, but we talked to him twice, and somebody else talked to him at Lobby Day last week. And he likes us, he agrees with some of our points. We're just going to keep chipping away at him. And
He feels that healthcare is a choice, it's not a right.
Yeah, he gives that. He says everybody should just go out and get a job, then they can get health care. Yeah. I'm sorry?
How did we come across?
Bernie had a great answer when he's debating Ted Cruz. He said, well, you have access to the Trump Tower, all you need is $1 billion.
Yeah, it's going to be hard to break through that, but I feel like we can do it. He's not an angry kind of Republican. Some of them are, but he's not so much. I don't know. We'll see. But we're going to keep chipping away at all the Republicans in our region. We cover Butler County, Hamilton, Claremont, Warren, Brown, Adams, Clinton, and Highland. So we're going to get out to all those other counties. We've been to Butler and Warren, and we haven't we're getting ready to talk to one of the legislators in Warrentown. So, we feel like we're making some headway. So basically, we feel that healthcare is a moral issue. It is a basic human right. I feel that healthcare in the past 30 years has drifted away from its original purpose of healing and caring for people. It's become a corporate enterprise that treats patients as customers. Yeah. And I remember as a nurse, I don't know how far back it was, but I believe I was working at University Hospital then, when they started saying, we're going to start calling patients customers. Really? Yeah. So, and it just didn't sound right to me. I didn't know a lot about single payer then, but I just didn't quite jive with that. That's kind of gone away, I think, but there are a lot of other things that they're doing. So we need to return to the mission of healthcare, which is to help people stay healthy and heal the sick and the injured, and care for the sick and the injured and dying. So I do want to pass out some information. I'll pass it around, which there's some on your table. We would love for you all to become members for $40 a year. If you can buy a t-shirt. Now I don't have sizes here today, but if you let me know you want one. This is our t-shirt for $20. If you become a member, you get $5 off the t-shirt. Okay. My cousin from California came to visit me, and of course she's a big old liberal, and she bought a t-shirt. And we went grocery shopping together. And she was wearing her t-shirt, and I don't wear it out all the time. And some guy stopped her and said, "Hey, that's a great idea," So I gave him my card, and we talked a little bit. But anyway, I think they're pretty neat. This is a size 2X. If you wear 2X or 3X, I have some for you. But we're ordering the smaller sizes. And then a couple other important things. We have an annual conference in Columbus, and it's coming up Saturday, April 27th. It starts at 9:30. It's at the Quest Center. And there'll be some very interesting information there. The keynote speaker is a man named Michael Whiting. Thank you for helping me remember. He's a nurse from California Nurses Association, and also was a past president of National Nurses United, which is California Nurses Association, sort of branched off into National Nurses United, which is going around trying to help nurses unionize. And he's a terrific speaker. I have heard him. And then we have some breakout sessions that are really interesting, like how to talk to legislators and how to handle social media and that kind of thing. So if you're interested, the registration forms for the, you can pass them around for the conference are there. I don't have a whole lot of those, but you can get on the website and sign up there too. And if you just let me know if you want a t-shirt and you sign up for that, or if you want one and you don't sign up for it. Or I'm sorry, if you become a member and you want a t-shirt. And then I will hold a t-shirt for you when we get it. We're going to get them in April. Excuse me. The other thing is we have letters for people to sign to your legislator. And these are very effective, actually. And I know probably maybe many of you are in Hamilton County. Excuse me. And we've pretty much got Hamilton County on board, except for Tom Brigman. But when even though, you know, your legislator might be Bridget Kelly or Catherine Ingram, who co-sponsored the bill last year, we still like to get the letters because it's effective to keep them. Let them know that we're still working on this, but especially for the other people in other counties or the Republicans. When I handed George Lang a file of letters, he was kind of surprised. And I said, these are people that are in your district that support this. So we'd love for you to sign a letter. If you, yes, George Lang, he registered for the state conference.
Whoa.
I don't know. We'll see if he makes it. He handed me the money and the form. See if I can get him to buy a T-shirt. That'd be something, wouldn't it? Yeah. Okay, and then we would love for you to join us, a membership, or if you just want to be on the database and not a paid member, that's fine. If you fill this out with your address, email, and phone number is optional, we'll put you on the database and you'll get our emails. We don't send out tons of emails, maybe just a couple a month. And if you're an active member, I have a group email that I send out a little more information on what's going on here in Southwest Ohio. We meet, you want to pass those around? We meet once a month. Yeah, I did. Yeah, that's the letter. You signed it.
This is for the letters.
Yeah, that's for the letters.
Yeah, I did.
Yeah. What was I going to say? Oh, we meet once a month on the fourth Wednesday of the month. We're now meeting at the Community Friends Meeting House at 3960 Winding Way. Fourth Wednesday from 6:30 to 8:30, and that's the Quaker Meeting House there. So we will meet the next Wednesday, the 27th. So. I'm sorry, yes.
Ready to take questions from Dee? Oh, yeah. And you pass it down to Michael when you're done. Mine's on here. Okay.
Who's mine? Okay, at any rate. Thanks for the wonderful information. The statistics are really great. I'm a nurse of 40 years, and I actually work with Dr. Bozian at University Hospital, just saying, at any rate. And I've been involved since SICO. In worrying, and thinking about SPAN and I know Don Rucknagel, blah, blah, blah. Anyway, here's what has come to mind as a result of your talk. Blacks and Latinos are less educated generally and expect less good health care. Americans really are guinea pigs for drug companies, and those of us who are educated know this. And just as an example from my own life, I told my doctor what dose I'm going to take. Now I don't know how many blacks and Latinos that are uneducated are going to go into their doctor's office and say that. But he knows that I know what I'm doing. He will prescribe according to the guidelines, but he knows, he's like, okay, that's great. So that's just one thing that would impact the black and Latino less health care, less outcomes. And I can tell you, as a nurse, that I expected blacks and Latinos to expect less. Just saying. Now I worked at university, and of course, I wouldn't give less. But if somebody said to me, hey, what about this? I said, well, I'll ask your doctor, or you ask your doctor, or even, what's going on with the thing?
Be careful. You have to sit still.
Okay, I have to sit still. Okay. And if somebody said to, now, very often, what I would do sometimes under the table is I would say, listen, this is what I know. You don't tell them I told you, but you tell your doctor, blah, blah, blah. Or ask your doctor, blah, blah, blah. Educating them. And this is why people love nurses, because this is the kind of stuff we do. Okay. Well, yeah, I wondered if there was any research done. I don't know how you would do a qualitative study about the expectations of blacks and Latinos affecting their outcomes. I mean, and it's a self-fulfilling prophecy. That's all I'm saying. And just as to give a plug for the National Nurses United, actually I did organize for them, and their proposal was the same as Hillary's. In 1992, you can say what you want about her, but before she caved in, she really had a good health care plan. The reason why she got killed is because she was making business pay for it. Done.
Next, second over there. She's got the mic over there.
I'm really encouraged to hear what you say about the...
Can't hear you.
It's the mic, all the way up close. Is it on? There it is, now it's on. Okay.
I'm encouraged to hear what you say about the legislature in Cincinnati.
Oh, yeah, put your mouth.
We went up to Columbus last Wednesday. We spoke to Ken Smith, who's the Democratic minority whip. We said to him, will you co-sponsor the bill? Long pause. Well, I'll have to wait about that. Why? The cost. Yes. He said, I'll have to balance the figures. We went round from different people, we talked to them, we got the figures from them. How can we afford not to have this bill pass?
Exactly.
Because we are going into amazing debt, people are dying, we've got to do something. And I just don't know how your information from Cincinnati, which is very encouraging, squares with our representative in Columbus, who's the Democratic whip, who's trying to get co-sponsors together. I mean, I came today wondering, is it going to happen? It's impossible if that is our whip in Columbus.
You're fighting an industry that'll fight tooth and nail to keep from killing us.
We're actually going to save money with single payer.
Sure. But how are we going to get it through the bill? Sorry.
The overhead right now is 30% that goes to insurance companies for doing nothing but saying you can't have that x-ray. Medicare is like 3%. There are estimates that we will save trillions of dollars. Plus it gets the companies off the hook. You know, General Motors doesn't have to do insurance. We're going to save a lot of money doing it. You know, that's what people don't get. They say we can't afford it. It's not true. I think California passed it twice and Schwarzenegger vetoed it, right? Dee? I'm pretty sure.
That was the nurse-patient ratio. I'm not sure about single payer, but I think they have problems because their tax, several years back when they voted on taxes to be at a steady rate or something, I don't know, but it's an issue. I mean, the legislators are there, and obviously the governor's there, so they have to get around that. I don't know.
I was, excuse me, I was with Di and Fran. We all were in Columbus last week, so I know where she's coming from. Because even the Democrats that we met with, as a whole, were fairly pessimistic. I mean, you talk about a Senate that is maybe skewed 98, 28, I believe, I don't know the exact numbers from GOP to Dems. Yes, economic-wise, it does make sense. We had all the economic information prepared for them, left them with brochures, et cetera, et cetera. So the question I have is, we are putting most of our effort into these legislators, am I correct?
Right now, that's what we're doing,
Okay.
yeah.
So the legislators and politicians in general, they only care about one thing. We all know what that is, right? To get reelected. Okay, now, it would seem to me that a more effective approach, I mean, this is not ineffective, I mean, for exposure, but maybe something that might be more effective would be having the equivalent of town halls in various counties throughout the state and having the constituents within the respective districts coming to these and talking about health care themselves and then encouraging them to call their legislators. Because that's when they're going to start to listen. And is there any attempt to do that?
We are starting to do that, yeah. We haven't done it here, but I think Deb's going to help me organize one. Right, I think?
Yeah.
And,
I mean,
and
doesn't
then,
that make sense to,
yeah,
I mean,
to have it directly with the legislator.
well, no, I mean, get with the public.
Yeah.
Get the public and then have these meetings, have them speak on these topics.
Yeah.
Encourage them to call. That's when they start to listen. So how do we do that from Span Central? Get them to look at that strategy instead of just relying on going back and back to these. And
By
even
coming to the Democratic
even
groups.
Beth Litton, I can't remember her name, who was the MD, said, or Liston, said, we're just gonna have to vote them out. Well, the odds of doing that.
That's
So-
part of it, yeah, and that'll change when the gerrymandering is kind of fixed, hopefully. But, yeah, and I plan to tell him, if, like George Lang, if he doesn't come around pretty soon, I'm gonna say, I'm gonna work towards voting you out.
But how do you get to the public is what I'm saying. How can we get Span to say, let's try a new strategy here. Let's get our representatives out to the public, to the respective different counties, have their meetings.
Well, we go all over the place. As I said, we haven't been out to some of those outlying counties in our region yet, other than Warren County and Claremont, but we're going to, not Warren County and Butler, we're going to Claremont County pretty soon. But, I mean, in our group, we have about 15 or 20 active members. So I need you to come to our meetings and sign up to do these things.
Hi, my name's Monica, and I congratulate you on all the hard work that you've been doing. It seems as though it's being pretty effective. I just want to know the number of the House bill that is being reintroduced again.
We don't know it yet. We don't know it.
Do we have a resolution number or anything, or or a sponsor, who the sponsors are again?
Mike Spindell is going to introduce it, and we have some sponsors. Well, Sheehy is definitely going to sponsor. I'm pretty sure there's the one named Joe Miller that we talked to. I'm pretty sure.
I'm sorry, Joe who?
Miller.
Joe
He's
Miller.
from way over in the east side of Ohio.
Okay.
And probably the ones that sponsored before. We had Bridget Kelly, we had Catherine Ingram, we had Alicia Reese, but she's not there now, but Cedric Denson, I'm sure, will co-sponsor. And I'm pretty sure that Jessica Miranda will. We're going to talk to her. That's our region. I'm hoping that all those coordinators are going to get out to everybody in their region. We're working on the Republicans now.
I get it, the Span Ohio bill is a very good thing, although maybe not the ideal of a national health plan for everybody. You said that 15 states had come close. Does that mean they've come close to passing bills, or
No.
they have gotten improved systems that are closer to a single payer system?
15 states have an organization like ours. That doesn't mean they've come close.
Well, some states, I mean, you pointed out that some states have a lot better results, a lot better systems than Ohio
California
does.
and New York, because they're, very progressive. And, I wouldn't say we're coming close, but we're making some progress. And I've said 15 states have an organization in place like Span Ohio that are working on this grassroots organization.
But for the actual medical systems they have in place, are Ohio, are New York and California and Massachusetts somewhat ahead of us, somewhat ahead of Ohio?
Well, I think,
by reason of somewhat better legislation?
yeah, I think New York and California are definitely ahead of us. They have legislators and governors that, are on board. And Vermont actually passed it through their legislature, and they had a Democratic governor, and then he backed off on it because he was worried about the finances. They could have had it.
Do any states have in effect anything that's halfway close to the Ohio Span plan?
I don't know what their bills say. I think they're probably pretty similar. I haven't read the other states' bills. I don't know, but I'm pretty sure they're pretty similar. They're pure Medicare for all, expanded Medicare for all. If you get on our website, by the way, you can read the bills. If you want to read through a 30-some page bill. You can also read the 60-some page financial impact study, which is really interesting. You can get through it. It's fascinating.
Okay.
So get a lot of information there.
Okay.
When you talk about the mission of healthcare, I think it's important to stress that capitalism does not think preventive medicine is profitable. And I remember Bill Maher saying, a doctor has never asked him what he eats. I challenged a doctor of mine because I'd heard that in med school they never teach anything about nutrition. He said, "Oh no, that's not true. If you have cancer, I know what you should be eating. If you have stomach trouble, I know what you're eating." It's totally, even when they study nutrition, it's totally tied to specific maladies. never to actual prevention, which is a crucial part of any real healthcare plan.
I agree, but I think that's changing somewhat with, the younger generation of doctors that's coming up. But I do want to say one thing. I hear some people that sort of complain about their medical care, and it's not, the medical care in our country is not the problem. We have really superior medical care, but a lot of other countries do have just as good. It's the financing of medical care that's the problem, and the fact that people can't get access. Now, I can complain too about my doctor didn't tell me this, except I'm a nurse and I ask him everything. I go in there with a list and I tell him, well, what about this dose or that dose? But everybody doesn't do that, but that's okay. I'm sorry?
It's education.
Yeah.
Being educated about.
But the point is, we have, right here, I just want to say this one point. In this city, we have the second best pediatric hospital in the nation, and probably one of the best in the world. And I know, because I worked there, not that I'm saying anything, but I worked with some amazing doctors and nurses. But we have such a high infant mortality rate, and the care of children is not good because we have a high poverty rate. I do want to mention there's an organization that was started from Cincinnati Children's called Greater Cincinnati. They're working on that infant mortality rate. It sounds like a really good, they just started a couple years ago, and they go out, they do home visits with nurses, social workers, for women, I think before they have the baby, and then after continue to make visits. So I hope they can make some inroads. But it's astonishing that we have that here in Cincinnati, and we have the second best pediatric hospital in the nation. It's unbelievable.
Question is here.
Tell them Spanville covers more than that.
Go ahead.
To expand on what Peter said, that is totally true about capitalism. I'm not knocking capitalism, but to finance this healthcare for all, we need to not subsidize corporations that sell us sugar soda, water, Nestle, processed foods that destroy our health, and also petrochemical companies that destroy the air and cause asthma. Corporations need to help fund this because they're the cause of it, and we're suffering. We're bearing all the external costs. I'm not an economist, but there's a term for it. We're bearing all the costs, and they're not. They're just selling us stuff. And we're bearing all the costs, our deterioration of health. Also, one more thing, I work for the VA. The VA system is great. It's for eligible vets. And we're all vets, we're all heroes in this country. We all deserve the same care. They cover dental and optical also. And that's all part of health. Why should dental be set aside? It's all part of health.
Right, and that's what the Medicare for All bills do. They cover dental, vision, and hearing, and expand services for mental health. Go ahead.
Even the veterans can use it, use the single payer.
Okay.
Look, all the work you're doing is valuable, whether or not you get anywhere with the Ohio legislature, because we're going to have and do have a lot of national candidates for office, 2020 presidents on, that we hope will get through a national Medicare for all. Now, so that's how your work plays in, it seems to me, to help educate people, to elect people that will work for Medicare for all. Now, in terms of the cost of it, the attacks by the health industry and the insurance industry, of course, are going to focus on the cost. And the media hasn't done well with that, because in England, when I was there for a year back in the 80s, this is the way they covered the cost. Everybody paid through their taxes a health tax. I mean, they paid something everybody had it. If you didn't have any income, you still had it. Birth to grave, medical care. But if you had an income, you would pay something, as you would your taxes. Part of your taxes, or I believe there was a separate health tax, I call it, that you would pay. Now, that makes perfect sense. We would all pay something. The government's not going to be broke. I mean, they will have to administer the same way that Medicare for All is administered, but that's not huge. It's not big at all. So we have to constantly attack the media take and the insurance take. This will break us. Be nice to have it, but we can't possibly afford it now. You know. So, okay.
When people say, I don't want to pay for those people's health care because they don't have a job, they're lazy, I say, you are paying for it. We're all paying for it, because when they get sick, they go to the ER, which is the most expensive place to go, and then they're sicker, and it's going to cost more. So we're already paying for everybody.
Health insurance premium is considered a tax already.
Right, that's another thing.
I'd like to thank Dee for being with us today. Thank you very much. If you have further questions, you can speak with her at the end here. But I want to thank you very much. Susan Noonan from the FBI Citizens Academy will be here next week. I'm kind of fascinated as to what that is. And so hopefully we will see you here next week. Thank you all, everyone.
Thank you.